Hello, and welcome back to Authentically Shawna. I'm your host, Dr. Shawna Burke. Today, I am joined by Ashley Shapiro, who is an RN and an international board certified lactation consultant. And we are going to talk all things lactation today. So, welcome, Ashley.
Thank you. I'm so excited. I can't wait. It's going to be a blast.
Okay, tell me more about how you got interested in lactation consulting, what it means to be board certified. What does that process look like?
Yeah. So for me, it's a little bit different. There's different pathways that you can do. But for me specifically, I'm an RN. So as a nurse, I've already taken all those science classes. And so all that health and science requirement is already completed. For me, I did pathway 2 through UCSD. So they have a great lactation program. If anybody's thinking about becoming a lactation consultant,
Amazing.
you'll do the program, you'll sit for boards, and then you become board certified. So for me personally, I have 2 kids. I struggled with breastfeeding. It was like a horrible experience. I thought I was going to be walking the park. You see like these cute moms and their sundresses and their hats and they're in the flower fields breastfeeding. I was like, oh, I got this. I'm a nurse. I know how to do this. And then I had my daughter and I was like, what the heck is this? So it was really challenging, but I'm super grateful, like looking back, to have that experience because like if I didn't, I wouldn't be here today. So
And what was so challenging, if you don't mind me asking, about breastfeeding?
it was hard and it hurt. And I didn't know in that moment that breastfeeding shouldn't hurt. I mean, my nipples were like cracked, bleeding, all the things where I just thought was normal and it wasn't. And I did that for 6 weeks. And one of my girlfriends was like, why don't you see a lactation consultant? And I was like, what? A what? She's like, a lactation consultant. It's somebody who specializes in breastfeeding your baby to help with pains or nipples. If you have low milk supply, they kind of do it all. And so that kind of changed my life in a weird way, obviously, because my breastfeeding journey, it was really important to me to breastfeed. And then I became a lactation consultant because of that experience. So kind of cool. It's like one of those bittersweet, wow, I wish I didn't struggle for as long as I did, but I wouldn't be here today if it wasn't for those struggles.
And what were the key hallmark takeaways that you learned when you were on the client end?
That it really shouldn't hurt, not normal, but that there's help. And if you ask the right people, actually, a lot on my website, a lot about my story, I talk about how I previously met with my first IBCLC. We just didn't click. It wasn't the right fit. Like she said things to me that I feel like no mom should ever hear. And in that experience, I think that helps me today. I was like, I never want anybody to feel the way I felt, the way she said things to me, the way I was treated. And so I think that experience set with me as obviously a mom, but also a provider for these moms who are in my shoes, who are like crying up at 3 a.m. They hate it, but they want to keep going because it's really important to them. Biggest takeaway is probably breastfeeding shouldn't hurt. In that moment, that changed for me and I didn't know that was normal. So a lot of moms, they think breastfeeding and pumping, it's okay to hurt and it really shouldn't.
And let's go back, like pregnancy. What are things that people can do to prepare for postpartum? Because I don't have any children myself. I've never had children, but I know that I have witnessed other people have a lot of issues that they didn't even know were going to be issues. And so if you could rewind the tape and say, okay, when I was pregnant, these are the certain things I would have lined up knowing now what I know now.
That's such a good point. I wish I would have done a prenatal appointment. So as a lactation consultant, I love to meet you prenatally. I want you to come in while you're pregnant, learn what to expect, what's normal, what's not, when to call me when there's a problem. I wish I had that. I did like the classic hospital breastfeeding 101 class. It's just generic to like a group of 50 people, but it's not specific to you. They don't teach you how to actually latch your baby. They don't actually teach you how to hand express. So I wish I had that. I wish I had that like one-on-one prenatal experience. When I have you come in for prenatal, I do a whole assessment. That's like my nurse background coming into play. But
Amazing.
I want to know like what could affect breastfeeding. If you've had breast implants, how do we bat that before the baby's even here? So yeah, prenatal is huge. If you're pregnant, thinking about breastfeeding, highly recommend connecting with a local IBCLC.
And when's a good timeline to do that? When in the pregnancy do you recommend?
I like to see moms anywhere 37 weeks beyond. So 37 weeks, anytime after that. We can do hand expression at 37 weeks if you've heard of like colostrum harvesting. For those who haven't, it's where you manually hand express yourself. You collect your breast milk and you have it if your baby is jaundiced, a low blood sugar, severe weight loss. So it's cool because if you need to supplement by giving like donor milk formula, you use your own milk. So you don't have to resource to formula or donor milk. And it's really cool. You learn how to like hold your breast, like things we don't talk about. Before I had kids, I was like, do what to my boob? You sandwich your boob? What are we talking about? But to physically have someone show me like, hey, this is what we're going to do with your boob. This is how we latch your baby would have been a game changer for me.
And who else on your team would you have really appreciated? Like pre and then post, what having gone through this 2 times with 2 different
Pelvic
kids.
PT.
Yeah,
And
absolutely.
I mean, honestly, there's so many things you don't think about. Myself personally, I prepared for like the birth, how to breathe, how to push, all the things, but I didn't think about postpartum. You have the baby and now what? There's no manual, there's no book. In the hospital, they educate you on things, but you don't remember. You're exhausted. Prenatally, I'm really big on PT, getting all of your pelvic floor muscles aligned, knowing how to do things, how to use things. Lactation obviously is a big one because all you do postpartum is feed your baby. Lactation consultants can help us like formula feeding too. We can combo feed. So it doesn't have to be all or nothing. I think that's where people think, oh, I'm not like 100% breastfeeding. I can't go get help. I never want a mom to feel like they can't get help. They can come see me if they're half formula, half breast milk. It doesn't really matter. You just need someone to support you. A doula would have been cool to have for sure, a postpartum doula. Luckily, my husband was like my doula. I joke that he should have been hired and I should have paid him because he was like amazing. But he did a lot of the cooking, cleaning, taking care of me so I could take care of the babies. So I think your partner plays a big role, and then family support. Who can you call on? Or do you have a best friend that could come over at like midnight and help you breastfeed, right? So having those support people on speed dial for sure. I mean, I'm sure I'm missing some. There's a million.
No, I love to ask everyone's experience, right? Because everyone has such a different experience of, okay, what were the things that were helpful for me in this moment in time?
Yeah, for me, it was my main focus mostly, and everybody's different. I feel like my births were pretty good. I had pretty great births, and healing wise, my first obviously is a different story because I had no idea what was going on. But the second one, my recovery was a lot smoother. So for me, it was more I needed help with lactation. So that was my biggest thing because I really wanted to breastfeed.
And when we're talking about lactation, do you also help people know what supplies to have? I feel like that's a big thing. Also in the PT world, like people don't even know what supplies they need to have. Like, okay, what are good things to have on hand? So is that something that you also cover in your appointments?
We cover in the prenatal. So in the prenatal, we talk about like pumps, when to pump. There's lots of different tools and gadgets. I'm kind of like the less is best. The less we have to intervene, the less we have to throw on, the less we have to buy. It's going to make your life a lot easier. I'm really big. There's a pillow called My Breast Friend. It's that little one over there. But it's a great one because it helps properly position the baby. And we get mommy wrists, which you probably could touch on a little bit.
Yeah.
That, but that helps relieve that strain on your wrist of holding the baby breastfeeding for 20 minutes. So I'm a less is best. I'll talk about pumps, what kind of pumps, and then supportive pillows if we need any of those.
Yeah, I definitely see moms postpartum with neck and shoulder issues as well, just because they're not used to doing this isometric hold for a really long time. They didn't train for it because it's a weird thing to say. Like you're going to sit for a long time in one position and not get to move. And you've never trained your body to do that. So I see a lot of women in that category in my practice as well.
Head and neck for sure. I mean, I see them and they're hunched over. I'm like, well, no wonder your back is killing you because you're doing this, but getting in that proper alignment, getting baby in the proper alignment.
Absolutely. And having tools to help.
Having tools if we need them. Exactly. If it's like too hard for them to hold the baby, then use a pillow. Who cares? You're not going to go to college with the pillow. Just use it for the first few weeks postpartum.
Right.
And then you don't need it forever. But yeah, it's real. Moms don't think, oh, the mommy wrist or like the sore neck and back.
Absolutely. Which is why it's great to have a lactation consultant and a PT on your team.
100%.
Because then, you can have some help because, again, like you're saying, breastfeeding shouldn't hurt, but also your body doesn't need to hurt.
Yeah. Your body's recovering from birth. The other thing is like, babies get heavy over time. So holding them, your positioning, I'm sure you see a lot of that too. Moms have like sore arms, all the things because we're not trained, like you said. We're not training for this big marathon of holding and feeding and all the things.
Let's talk about latching and tongues. And I know there's this whole conversation that I don't think existed when we grew up of having tongue ties and myofascial restriction. We didn't have the internet. Those things weren't
like
our moms weren't like concerned about that. Like how is that impacting your practice? What are you seeing currently?
So I joke and say that I see like a lot of the problems, right? Like most people, I would say probably 10% just come in to check in because they want to make sure everything's right. Most of the moms I see have issues or they have tongue ties or there's some anatomy going on that's affecting that, right? So we always look at function. So for me personally, when they come in, we'll weigh the baby, I look in the mouth, I assess like that function, that anatomy, and then we kind of go from there. So latching, um, it's a simple process. I think we tend to overcomplicate things, especially on social media. People say, do this, do that. The worst is like my clients will come in and they'll say, on TikTok, I saw this. And I'm like, oh, here we go again on TikTok. But, sometimes I learn stuff too from TikTok. So I'm not going to bash it too much, but teaching them the proper latch. So there should be a nice seal, no air, lips should be nice and flanged. As far as tongue ties go, that's a whole nother, we could talk about that forever. But long story short, we all have some sort of stricture there. That's how our tongue stays in our mouth. Whether it causes an issue with function or not is determined upon the baby, how they're feeding, what they look like. I think now we're learning so much. There's so much research out there showing, could it lead to airway? Could it lead to difficulty with solids? It's crazy. We don't think about the body and how it's all connected, but trauma from birth can affect how they feed. There's so many body work things that we're now just discovering affect the feeding. So it's kind of cool to see it all come together. I know depending on who you ask, people are like, tongue ties are horrible. And some people are like, we don't believe in them. But like, if we're doing all the things, we're trying to help the baby, we've done X, Y, Z. I love any body work. That's usually my first line, OT, PT, chiro, getting that on board. At that point, if it's not improving, maybe we need to see a pediatric dentist. Maybe it is causing an issue with that function.
And you can see that pretty clearly.
You can see that.
It.
Yep. Yeah, they're usually more chompy on the breast. They can't maintain that seal. When we're checking for function, they can't fold and cup that tongue like they should. So, yeah.
And are you actively helping people find the next person? Are you like, hey, this is past how I can help. We've tried all the things. Here's the next person.
Yeah. I think, especially in Orange County, we're like so dialed in with resources. We have great providers down here that are just super aware and collaborate with like lactation consultants, PT, OT, you name it. So that's super nice. I do have like my preferred list of like people I would take my kids to.
I love that.
My approach is a little bit more conservative. I'm more that like natural, like, holistic, let's let the baby work through it. So I tend to like lead families to providers like that. I'm not going to send you to a place that just like lasers off everything because they see something, right? Just because we have something doesn't mean there's an issue with function. So it's a touchy subject.
It is,
depending
definitely.
on who you ask. But I mean, we all have it, right? And I think, like you said, our generation just didn't know. Our parents were like, whatever, they just won't breastfeed. And back in the day, they used to push formula and say that's best for your baby. So like anything, we're evolving with time and we do the best we can with the information that we have.
Let's talk about stages of breastfeeding, because I know immediately postpartum, everyone goes in their own trajectory. It's like you're saying, you're only doing breastfeeding, you're doing a combination, you're weaning yourself off. What are different pathways that you see most people following who come into your office?
So far as like how that milk pathway works, right? It's mostly stimulation. So we have to remove milk to make it. So in order for our body to start making milk, we need that frequent breastfeeding. So what I always encourage is at least 8 feedings in a day. That's the minimum you can do to help stimulate that transition from colostrum to mature milk. So colostrum's the first milk. It's like liquid gold. It's high in antibodies, vitamins, stem cells, you name it, it's in there. We joke that it's like a salty protein shake. Bodybuilders, like, like Arma.
Yes.
Well, people pay for colostrum on the black market, okay? Like, it's good stuff. I always tell my moms, if you have any extra, just put on Facebook Marketplace. Someone will get it. No, don't sell your breast milk. Please donate it to somebody who needs it. But yeah, it's great. It's that first milk and then it transitions. So somewhere around day 3 to 5, that progression, the hormones, right? When you deliver your placenta, it's the biggest hormonal shift your body will ever have. So your body kind of automatically pushes that through. And then once that passes, you get into the phase of how we remove milk to make milk. So breastfeeding frequently is what's going to help kickstart that. And it's really established in the first few weeks of life.
Now let's talk about nutrition, because I'm sure that's something that you speak a lot about, because in order to make food, you also have to be consuming enough calories.
Yes, that's a huge one. So eating, drinking, really staying well hydrated. I'm really big on protein. I'm like any protein you can get, protein shake, protein, the chomps, that are out there.
Yes.
We don't eat enough. No, women really struggle with getting protein. So working with a nutritionist would be a good idea. If you know somebody who's super into nutrition, that's like who I'd connect with, talking about like putting them on your team of how do I get this protein in, or what do I eat to get the maximum amount of protein. So I always encourage my moms to have like a protein shake at their bedside. If they can't like get up and cook themselves a meal, have something, have a chomps, have something that gets you that protein. I like oatmeal, eggs, all like the traditional, more ancestral foods. We don't need a lot. We don't need a lot of processed stuff, just whole ingredients to help maintain that nourishing postpartum, if you will. Yeah.
And then let's talk about the baby. Also nourishment. What's a good way to tell if your baby is getting enough?
Good question. Yeah, this is one of the biggest questions I get asked. So each day of life in the first week, really, they should have that many poops and pees. So rule of thumb, poop, pee, weight gain. As long as those are trending in the right direction, we know the baby's getting enough. Each day of life, they should have that many poops and pees. So if the baby's 3 days old, 3 poops, 3 pees. 4 days old, 4 poops, until we go up to a week. And then at 1 week, it's 6 to 8 wet diapers or 6 plus, and then 3 to 4 poops a day. So that's how I measure. Between myself and your pediatrician, we'll do the weight checks, and then that's where they would come in. I weigh the baby, they feed the baby, and then we weigh the baby again. And so it's nice reassurance for them to see that number. Oh, my baby drank that much milk. Because breastfeeding, you don't know. It's kind of like a guessing game, and you hope for the diapers, and you weigh in when you go to the pediatrician, and that's it. So
what's a good way for people to tell it when their baby is full or satiated?
So typically their hands will relax, they'll open up. They stay calm. They're not fussy in between feedings. Doesn't include growth spurts, though. I think a lot of people forget that babies are growing like crazy. So when they have a growth spurt, they're more cranky, more inconsolable. They'll go like 30 minutes and be like, oh my gosh, my baby's hungry again. Something's wrong. Well, no, it's normal. But typically relaxed, pooping, peeing, they're giving you like those 2 to 3 hour stretches. The thing is, we can't program babies. So perfect world, I'd be like, this baby would sleep for 3 hours. But some babies don't, and they're still getting enough, and they're still doing great. So I think if you're questioning or have any concerns, reach out to an IBCLC in your area, support group, go do a weighted feed, see how much your baby's transferring, and it gives you that reassurance like, yeah, we're doing okay. Obviously, if they're like growing out of their clothes and their newborn diapers, that's a good sign too. But yeah, thriving, healthy babies.
I know I hear this a lot. How or what advice do you give about babies like chomping on breast while feeding?
That would be like an OT, send you to OT. Yeah, occupational therapy. They work so well with babies. They work on motor muscles in the mouth. They work on body tension, releasing all that. We can do a few tips in here, like different positioning tools, getting the baby in different angles. I'm helping them open up the mouth and see if they can utilize the tongue. But typically, if it's anything beyond that, that's where OT would come in.
Amazing. And about how many people do you think, like within your practice, are you sending out to other people?
Depends on the week.
That's great. Depends on who walks in your door. Yeah.
I mean, I joke and say like we all need PT, we all need OT. Like after birth, our body goes through like crazy changes. We don't realize like when you're pushing, like the position you're in, like some people push for 3 hours. Your body is so strained during those 3 hours and punching over. I think everybody could benefit from some sort of body work, CFT, something to relax those muscles, that fascia, get back down to like just basics, chiro even.
Yeah. Let's talk about baby's trajectory. So are there normative values for how long breastfeeding lasts? When do you start to notice the signals when your baby doesn't want to breastfeed anymore? What are some normative values around there?
You're saying like duration of how long they should breastfeed for? Okay. So typically AAP recommends up to a year. So if you can breastfeed for up to a year, that's the goal. But it really depends on you. It depends what you want to do. It's your journey. If you decide, I want to do this for 3 months and then I want to be done, 3 months and be done. It's very dependent on the breastfeeding couple and how long they want to do that for.
And do you see people's milk supply tapering in about a year? Is that like what happens, or can you extend it out kind of however long you want to.
Yeah, you can extend it. The thing that's super cool about breast milk is it's always changing. That first milk, that colostrum, is not going to be the same as like your 2-month milk, which is not going to be the same as your 6-month milk. I mean, our milk is so cool. It even goes like Aunt Sally comes over, coughs in the baby's face. Your body is going to make antibodies to fight that illness. So yes, milk is always changing. It's always beneficial, even after 1. If you could go to 2, great. If you go to 3, sweet. If that's weird for you, stop. But AAP just says if you can get to at least 1 year of exclusive breastfeeding, you're good. It's constantly changing. I think that there are studies now, they're finding that there's more nutritional value from 1 to 2. So I think pediatricians are trying to encourage you to do more breastfeeding, but it's really up to you what you feel comfortable with.
And do you think that also impacts face shape? Like how long you breastfeed maybe impacts someone's face shape, what the muscles you're using versus chewing, and how that all plays a role?
Potentially, yeah, that would be more like an OT thing. I think going back to tongue tie, right? If that tongue is not elevating, expanding that palate, it definitely could affect, right? It depends how they're breastfeeding. If they're compensating and using those facial muscles instead of their tongue, that obviously can affect that too. So it's a good question. I don't know the answer to that one.
That's okay.
Great topic we should review.
Let's talk about teeth and babies start to get teeth and what happens with teething and breastfeeding.
So with teething and breastfeeding, you really shouldn't get bit. Like you really shouldn't be getting, these attacks all the time, but it happens. So what I typically say to do is like decrease inflammation, whether it's like a teething toy that you could put in the refrigerator for a few minutes. I love like a washcloth, like a baby washcloth, soak it in a little bit of breast milk, put it in a Ziploc baggie in the refrigerator, let them suck on that before. The biggest tip I will talk about with teething is try not to overreact. So yes, it's going to be very painful. You're going to be like, oh my gosh, you just bit my nipple. But try not to react, because when you have that reaction, it scares them. And so that's how babies go on nursing strikes, or they don't want to breastfeed. They're uncomfortable. They don't mean to. Now, if your baby is biting you and looking at you and laughing, yeah, obviously that's a different story. But with teething, they shouldn't be biting down on you. Sometimes that friction can cause a little bit of discomfort, but it shouldn't become a problem.
And then let's talk about mastitis, because I know that this comes up all the time in PT offices, and I'm sure your office. Like, what are tips, tricks that you have for that?
With mastitis, I joke that like everyone will experience it at least once, right? When you get that clogged, it's the inflammation of that clogged duct. So fever, chills, body aches. And back in the day, they used to say heat. We actually don't recommend heat anymore. We want to ice, take an anti-inflammatory, turmeric, anything that's going to help decrease that inflammation. And you want to breastfeed or pump like normal. You don't want to overdo it. The more you keep asking your body to make more milk, it's bringing more inflammation to the area. Typically, it's like if a bra's too tight or the latch is off, right? There's something happening where that milk's not being removed. Mom has oversupply. Could really be caused by anything, a clogged duct. So meeting with a professional and like helping you troubleshoot what is happening and why am I getting clogged ducts? If you're someone that's getting recurrent clogged ducts, that's something I would want to look into. Like, why is this happening to you? But typically latch, making sure the latch is good, right? There's nothing blocking those nipple pores that could be causing that milk to not come out.
Yeah. Do you recommend that people do an inspection? Like, hey, after feeding, take a look, make sure everything looks normal.
Yeah, you can. And that's one of the things too. So like with mastitis, you have like red, warm to touch. Sometimes you see red streaks. So if that's happening, you want to reach out to your lactation consultant. Typically, we have about 24 hours to play with it to help clear it. If not, that's where the antibiotics come into play. Antibiotics aren't bad. It's just if it's an inflammation issue, it's not going to help. Just going to prevent that infection or turn into an abscess. So it's preventing that. But yeah, you can inspect. You'll usually feel a clogged duct. It's like a hard bean or a rock. Most of your boobs, like the breast tissue, shouldn't feel like that. So if it becomes infected, you usually feel it. It's sore and warm to touch.
Speaking of breasts, what are some tips and tricks you have for breast health through breastfeeding years?
I mean, just get used to touching your boobs, number one. Number two, if you feel anything off, get it checked out. Don't wait. Luckily, our breasts, they self-clean themselves. We have Montgomery glands around our areola that help keep the breast clean. So there's really not a whole lot you need to do. That's back to the less is best topic, but really just taking care of yourself, wash your body. You don't need to like scrub and wash your breast. Your tissue is really sensitive. You have a baby breastfeeding a lot. So just general like cleanliness, how you would like wash your body, just wash your breasts.
Bras.
Bras. Oh man.
What? Oh man. Oh man. This is the topic that everyone wants to talk about but doesn't want to talk about. Let's talk about bras, breastfeeding. What do you recommend? What have you seen works, doesn't work?
So I'm a big fan of like the dual bras. So like the ones that are pumping and breastfeeding friendly. So the reason is if you're going to be spending a lot of money on bras, you want to get something that you're going to be comfortable in. We don't want it too tight. We don't recommend underwire. You want to be able to like live your daily life in your bra. If you could be braless, even better. Moms feel like their boobs are really heavy though, so they feel like they need that support. There's a few brands I like, Kindred Bravely and Auden, which is at Target actually. They have like a sleeping bra, a pumping bra, a nursing bra. Again, not too tight, no underwire. Make sure it's a nice snug fit, but not constricting any of your milk ducts.
How do you know when something is too snug? Do you feel like something isn't going right? I don't know. I haven't had this problem because I haven't done it. But how would you know, like, hey, this is a good fit versus a too snug a fit?
If it's like causing like redness, right, on your, let's say your band of your,
like your bra line area.
yeah.
Okay.
So if you're seeing that redness, that tightness, that compression,
Okay.
sometimes you even see indents on the moms of like the bras and the straps, because when you have a nursing bra, there's a little strap that connects to clip it on, take it off. So sometimes you'll see like indentations from that.
Okay.
Obviously like spillage. If your breasts are like exploding out of the bra, it's probably time to go up.
Okay.
That's session. No sports bras. If you do a sports bra, I shouldn't say no sports bras, but not too tight of a sports bra, because that can constrict everything as well.
Yeah.
Yeah.
Then let's talk about deodorant.
This is a good one. So depending on who you ask, some people don't wear it because they say that it absorbs and the baby smells it. To each their own, honestly. If you're someone who can walk around smelling your natural odor, sweet. Why not? I always say like your baby's not going to be in your armpit. They shouldn't be touching your armpit. If you're breastfeeding, you have like deodorant on, maybe just lift your shirt up so that you're not smushing your baby in that armpit area. But yes, I mean, depending on who you ask, they're saying it can be absorbed. So conversation for another day.
Yeah, I know it's so hard. It's so hard to know.
Ending.
There's not any right answer. There's not any wrong answer. It's just
yeah. I say just do your research, and if it aligns with you, then wear it. If it doesn't, maybe pick like a natural one. There's some, obviously, all the aluminum free. I always encourage. Unscented, I always encourage. The ones that are those like natural Toms, native, like the other one. But there's a bunch of more
Lumi. I use Lumi.
Lumi, yeah. There's more natural base deodorants that if you're concerned about it, either get one of those or don't wear it. Use a baby wipe.
That's a great idea. Let's talk about nighttime feeding. This is something that I discuss with my patients on a PT level, is what their arms are doing is they're getting really tired and fatigued because they're up in the middle of the night. Is besides using a pillow, what are other tips or tricks you give during nighttime? Because you're not alert. You are exhausted by this point. And I feel like people just do bizarre things posture-wise because they're so tired.
Exhausted.
Exhaustion
kicks in at 3 a.m.
Yeah.
I love side lying. Side lying, you lay next to your baby. They still breastfeed in that safe, comfortable position. You're not having to like sit up. You can lay next to each other. They have to be careful because you'll probably fall asleep next to each other.
Right.
Co-sleeping, I'm not even going to talk about because
that's a whole other
beast. I joke we co-slept with my first, and my second wanted nothing to do with it. So it works for some, but not for everyone.
Absolutely.
But yeah, I mean, if you're, 3 a.m, you're tired, you can't hold the baby, you don't want to use the pillow, side lie. It's a great position to do, especially when you're exhausted and you don't want to hold the baby up. You keep a nice neutral spine on your side. Both you and baby have that nice neutral alignment.
And I'm asking this because I don't know the question. Are you chatting with your patients about returning to exercise and what that looks like with breastfeeding?
Yeah. So back to the prenatal, right? When they first come in, we talk about like, what's your job? Are you going back to work? What do you do for physical activity? Do you want to, I feel like where we're at in this area, I share an office with a pediatric PT. So
if you hear some children laughing in the background, there's PT going on there next to us.
They're not crying. But yeah, so having that resource available, like in my office, is amazing because they do mommy and me returning to workout, how to safely do that. If not, I'm sending them to a PT who can help them because that's so important. Again, back to our body changes a lot. We don't realize those muscles, those abdominal wall, everything's changed. It's not what it used to be. And so easing yourself back into that with those supportive systems is a huge, huge thing for moms postpartum.
This is something, again, that I talk about with my patients. So wondering what the crossover is. I talk a lot about ribs and where their ribs are because after a baby, most people's ribs have expanded and their upper abdominals aren't as active as they probably were. And so I would imagine that that would also affect breastfeeding because of space and where the baby is. I had that conversation with my patient. So just I'm wondering, like, do you also have that conversation?
Like sitting up, right? Like after a C-section, or you see like the coning, right?
Yes.
Diastasis,
Yeah.
right?
Yeah.
So it's like you don't realize it, and then you go to sub, and you're like, oh, I can't do a crunch. It's like, well, yeah, girl, you were pregnant the last 9 months. Don't try and do that.
Right.
So yeah, just like body tweaks, especially for lactation. Like, how do we support that? That's where like the pillow is nice. I have them lean back, kick their feet up. So it's taking the pressure off those ribs, that abdomen, and you're more relaxed. And you're using more of like that back support more than anything.
Now, when people are getting ready for baby, do you have like chairs that you like? Like a breastfeeding chair? Just what are good sitting tools to have?
Yeah, I say anything that like you're comfortable in. So
Okay.
some moms like the gliders, some like the recliner, the rocking chair, like the classic rocking chair, a wood chair.
Yeah.
Probably going to hurt your bottom. Probably don't want to be sitting in like a hard wood chair. So I say something that has good back support, but is also cushiony. Everyone, I feel like when they come in, they love this couch. It's a futon. It's like nothing special. It's on Amazon. I'll link you if you want it. But I've had dads ask, they're like, where do we buy this couch? I'm like, I'll send you the link. But nothing, it doesn't have to be anything crazy. Like it could be a secondhand bought chair. It could be like your couch that you're comfortable in. You just want something that gives you that good back support, but you're not sinking into. So I don't really have like certain recommendations for that other than make sure it's comfortable for you and you feel supported.
Do you also chat with people about changing tables and posturing and good places? I feel like that also plays. That's generally conversations I've had. So I was wondering if there's any crossover and what are some good postures to be in because you're already bent over a lot breastfeeding. And how do we get you to have more open and upright?
Yeah, I will say one probably like is a sloth hold. So if they're like burping the baby, I usually say after a feeding, put them the head of the baby in like the crook of your arm, let them kind of lay on your arm. And then that way it helps take that pressure off your back. You're not hunching over to hold your baby. You're sitting up and just kind of patting their back. That's usually the only one I talk about. I don't go too much into that because our appointments go so fast. I'm like, okay, we have 5 seconds to talk about anything not lactation related. I feel like I get a lot of the questions because as a nurse, of course, background, I work in postpartum and labor and delivery. So people ask like, oh, is this rash normal? So I feel like whatever leftover time, they're asking like 20 questions on what's normal and what's not.
Which is so hard to know.
Yeah. I feel like I saved a trip to the pediatrician. So that's
agreed. That's amazing. That's such a good thing.
I honestly love it. I feel really grateful that like I am where I am because I know not a lot of IBCLCs are RNs. And so they don't get that newborn assessment hands-on experience. And so I think that's what kind of makes me a little bit different more than some of the other IBCLCs out there because I can help reassure them and let them know it's normal and what they're doing is enough. I think a lot of social media, we're always like, oh, are we doing this? We're not doing that. It's like, who cares? Like, do what works for you. You don't need to do 12 ounces in the fridge by 3 weeks or whatever is trending right now. I always say feed the baby, not the freezer. So.
I like it.
Yeah.
Is there anything else that I haven't asked that's like typical questions or typical things that you would like to share?
I don't think so. I feel like we covered a good amount of
stuff. Good. Okay. I love that. Okay. Please plug yourself. Where can people work with you? How can people find you?
So I feel like I post a lot on social media. I love Instagram. It's like my favorite place. I don't love it. I like sharing information, but I don't like actually being on it. All my notifications are off. So if you ever need me, text me. But my website, it's www.ashleyshapirolactation.com.
I'll link it.
You can link it this month, which I don't know when this is airing, but this month we have a big birthday giveaway. So if you're following me, I have like 12 different companies who have like donated lots of cool things. My breast friend's one of them. oh my gosh, Mama Meals. There's so many good giveaways, but it's 4 years of my practice and then my birthday month. So I was like, we need to do something exciting. But mostly Instagram at Ashley Shapiro Lactation.
And when does that end?
The end of the month.
Okay. So this will air the last Monday of the month. So you have
just 7 days
to get on it,
go enter yourself in all 12. You just have to like tag 3 friends and that's it. So
perfect. Well, I hope you have a lot of entries then by the end of the month.
I know. I don't know. I turned it off. Like I said, notifications are off. I don't want to look.
Well, thank you so much. I learned a ton. I hope everyone else who's listening did as well. You've been listening to Authentically Shawna with Dr. Shawna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referred in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. See you next week.